It's an ordinary fall afternoon in Cumberland, November 2nd, 2009. The new Western Maryland Regional Medical Center is set to open within days. A monumental tribute to the perseverance and spirit of this community. Some said it couldn't be done, but over 2,000 employees, dozens of local builders and craftsmen, artists and architects have contributed to this enormous effort so near to completion. The area is alive with activity. Far from the stress of last-minute details and the excitement and anticipation of opening day, one of Cumberland's native sons sits content and quiet, doing what he loves best this time of year: hunting.
I was sitting alone in a tree stand about 4 o'clock in the evening. It's about an hour before dark, and my cell phone rang. And it was Teresa on the phone. I knew if she called me, something was wrong at that time of day. But she did call me. As soon as I picked up the phone, she was crying, so I knew she didn't get good news.
To him, November 2nd, 2009 will never be an ordinary date again.
It was definitely a shock. It's never easy to hear, hey, your family member has cancer.
I was surprised when I found out that, she had been diagnosed with cancer. Because again, it's not something that anybody plans on getting. It can happen at any time. You can be a perfectly healthy person and just kind of it gets something that gets sprung on you.
It's devastating to hear that, especially when it hits her family. And she's my sister and my baby sister, so it was very difficult.
We needed to be strong when she couldn't.
Over 1,500,000 people in the United States were diagnosed with cancer in 2009. More were diagnosed with breast cancer than any other form. More than 577,000 each year succumb to that dreaded disease. Many just call it the C word. That day, the phone call came that it was his wife. It was their mother. It was her baby sister. And without warning, even the strongest, happiest, most normal family in the neighborhood is shaken to the core. And a whole different world begins. Every single person is determined to get the best care possible for their precious family member.
Do you go out of town? Do you go to Morgantown? Do you go to Johns Hopkins? We got a second opinion. And our second opinion told us that they would get the same care there as we were offered here. So it's a lot easier for us. We're local. It's a lot easier to come out here every day versus driving 2 or 3 hours.
She had gone to Johns Hopkins to get a second opinion as far as what type of treatment she should get, whether surgery, chemo, radiation, or combination of the three would help her the most. And she got the exact same report down at Johns Hopkins that she got with Dr. Mavromatis and Dr. Watkins.
I encourage people to go out of town if they feel like that's what they need to do for peace of mind. But it didn't surprise me at all that they recommended she come back here, because what she needed was standard of care that we do here all the time.
We offer the best of care. I've worked in many different hospitals over the years, academic centers, and I've been impressed the most with our community, the staff, the nursing staff.
The Schwab Family Cancer Center is accredited by the Commission on Cancer and rates highly on critically important national benchmarks for cancer care.
One of the recent advances that we've been able to accomplish here at the Western Maryland Health System is stereotactic radiosurgery. We used finely focused, very small radiation beams to target small areas, and this allows us to treat high doses to small areas and spare the normal tissue.
Western Maryland Health System's Schwab Family Cancer Center provides state-of-the-art clinical care with hometown convenience, concern, and warmth.
I think that definitely eased her mind and eased our minds to know that she was getting exceptional care locally.
Teresa Mathews would become one of the first of more than 3,000 patients treated at the Western Maryland Health System's Schwab Family Cancer Center since it opened in 2009.
I had just recently come to the unit when Teresa came, and She was new and scared and just very overwhelmed. I want the person that I'm taking care of to know that, I understand. I know that they are scared to death.
I invest myself, and it's my passion to try to help them with all the aspects of it. Decision making, the diagnosis, the discussion, and the treatments, and then the follow-up.
The oncologist is just like a primary care physician. It's really a close relationship with our patients. I feel I'm just like their family physician. I enjoy that part. I enjoy what I'm doing. I love what I'm doing.
There's pretty much nothing we wouldn't do for our patients. You want to make every visit, every stay comfortable. Oh, that blanket warmer was the best thing ever. Ever.
And the staff truly treats the whole person and their family.
It's very important to me, specifically, to get to know my patients well. I like to know a lot about them in terms of what they do, the things that they enjoy, what their home life is like. It helps all of us get through the treatment and lets us realize that there is a whole person there and not just the patient we need to treat. 20 years ago, we were very happy if we cured the malignancy, and that was sort of it. Now we know that we cure the malignancy and the patients continue on with their lives.
After her surgeries and the first 2 or 3 chemo treatments were hard on her, but she started, with each successive one, I think each week she felt the effects more. She'd get, nauseated, sick, and you could see her getting weaker with each treatment as it went by.
The night that she lost all of her hair, I got engaged when Mom was going through the treatments, so she wanted to make sure, she wanted to make sure that she could be there for my wedding.
As the treatments progressed, she got weaker and sicker, which was extremely hard to see. I would take her home and put her in bed, and she would spend the next day or 2 in bed because she was so weak and sick.
The fear of the unknown is just horrible. You hear nothing else. All you hear is cancer, cancer. My name is Teresa Mathews, and I am a cancer survivor. I have not been let down one time by the service or the quality of service from Western Maryland Health System. Dr. Mavromatis has been a godsend to me. She told me step by step what was going to happen.
We have many more choices, and we're much more precise. Precision medicine, precision oncology. At least 2 to 3 new agents being approved over the past even year. It's been wonderful for those patients, and we have several. But there's more to come in all cancers, including breast cancer and colon cancer as well.
It's getting better and better, and with the new technology, new findings, new medications. So it's just very promising. It really can change a fatal disease to just a chronic disease, just like diabetes.
Mom's main motivation throughout this whole thing was to live to see all of her kids grown and married.
One of my mom's main goals was to dance at my sister's wedding.
Yes, my mom at my wedding, I've never seen her dance that way. It was a huge party.
I did dance at the wedding. I tell you, we were doing it all.
She was great. She was super, and Jenna was as happy as a lark.
It was not only a celebration of our marriage, but also a celebration of Mom being able to be there and take part in it in the way that she wanted to take part in our wedding.
My mom's personality, maybe the best word, is bubbly.
She has a very bubbly personality. She's full of laughter, full of life.
She's just getting up and going on vacation and just enjoying life and doing more than she ever did before.
I have good stuff coming.
We're starting to come into the good time again. We're getting closer to the retirement years. We got a lot more time now for just the 2 of us.
it happens. It can happen to anybody. Live every day. Be with the people you love. Life is precious. Simplicity, that is a big lesson. I would like to thank God for getting me through this very difficult time in my life. I want to thank Him for giving me a second chance.
So it's all good. And it all started here with her surgeries, with her treatment, with her recovery, and we're forever grateful.